Hey everybody, how's everybody doing? I'm just jotting down a final note here in my presentation for you guys. Don't want to forget a exercise that I want to teach you guys for glutes today. We're going to be talking about the beginner exercises to train your glutes to make sure that you can avoid a hip replacement surgery. And so we are, in case it's very hot, I'm sweating a little bit already here. I sweat easily. I sweat just looking outside, guys. So don't mind my sweat spots and everything. I am here with you guys, and I'm probably going to get even more perspired here soon. But where are you guys at? I hope you guys are all staying cool. I hope you guys are staying healthy and happy. Hopefully, if you're not, you're going to get healthier and happier watching today's video and learning from me. Chime in and comment where you're from. I want to know where you guys are from. So let's see who's here today. We got a new subscriber, a new member on our channel, Elizabeth Daniels. Welcome, Elizabeth. So she has become a channel member, which is so cool. That means that she's paying we have another one, Fernando Garcia too. Welcome, Fernando and Elizabeth. Thank you guys so much for joining our channel membership. What we're doing with that is if you become a channel member and you're commenting on our videos, we are first to get back to you. You guys are priority. If you have questions or whatever questions you have on our videos, some people will ask kind of some detailed questions in there, and we try to get back to you guys as soon as possible. We try to get back to everybody, but we're prioritizing our channel members. And just to distinguish, for those of you guys that are wondering, because we have a membership for our online programs that's separate from our YouTube channel membership. The YouTube channel membership is just for the YouTube channel. It doesn't give you access to our full programs. That's something separate altogether. Happy to talk more about that later on. But who else is here? Dr. Lyons is here. Hey, Dr. Lyons. She says, hello, everybody from Los Angeles. Caroline Shipsey. Hey, Caroline, over in the UK. Welcome. We got C. Kelly. Looking forward to this, Dr. Dave. I'm looking forward to helping you, C. Kelly. Glad you're here. Who else is here? We got Nathaniel asking a question. Nathaniel A. Miriam. The glute exercises are golden. On vacation, had to climb stairs to bed and bathroom. Climbed practicing the exercises going up and down. No discomfort. Awesome. Thank you, Dr. David. God bless you and team. Oh, that's fantastic news. I'm so glad to hear this. There's a certain way to use your glutes during stairs. Going up and down tends to be harder for people. And people just don't think about this. This isn't something that's normally taught. So you, Nathaniel, and Miriam have figured this out. So I'm so glad that it's benefiting you. Keep using it. Excellent. Cindy Knight King is here from Odessa, Texas. Hi, everyone. Have you guys been seeing all the chatter, all the videos from the World Cup, all the people sharing their experiences going through the U.S.? I have been so warmed by all the people trying barbecue and going through Texas and other parts of the country as well, and down in Mexico and Canada too. So it's been so much fun. So I hope you're getting some visitors out in Odessa, Texas, trying out your West Texas stuff. Kate 60 says, good afternoon from Richmond, Virginia. Hey, Kate, welcome. Kimberly, hi from the pool today. Oh my gosh, you're rubbing it in, Kimberly. I wish I was in the pool right now. Thanks for joining us, Kimberly. Happy you're here. Lori Wilson, she says, hi, hello, Dr. David. I enjoy your live chats. Thank you. Of course, happy to help you guys out. Happy to be here. We got another one here. Elizabeth Daniels says, hi, Elizabeth Daniels from West Wales, UK. And then she says, looking forward to my first time here. Welcome. I'm glad you're here. Hopefully we can help you out and get you on your way. Glad you're here. We got Beth, who says, did my first sit-ups this week. Whoa. So grateful for Dr. David, his team, and for his encouragement. That's a big deal. I love that you're doing that, Beth. I mean, I meet so many people with hip arthritis here in my clinic here, in El Paso. And the idea of doing a full-on sit-up seems so impossible to them at the start. And as we progress through the ab strengthening portion of the hip arthritis recovery program, they get to doing it. And then it becomes easy. It's just one of those things that you just have to be able to do, a movement that you should be able to maintain the rest of your life, because it makes your hip muscles work normally rather than working overtime and causing some trouble in your hips. So you're on your way, Beth. That's fantastic. Who's here? Julie Parker is in Sydney, Australia. I literally just got out of bed, 5:07 a.m. over there. Good morning, Julie. Thank you for joining us. Glad you're with us here. Ali says, hi, Dr. David. Thanks for joining us, Ali. Where are you from, Ali? I'd love to know what part of the world. Krabby Cakes says, yay, I actually caught the start of a live stream. Glad you're here, Krabby Cakes. I'd love to hear your questions, see what comments you have, and be able to help you out. You got Theopolis says, hello, Doc. Saying hello from Florida. Ooh, you got to be hot down there in Florida. Glad you're joining us. Kit Kat says, watching celebrities like Madonna after bilateral hip replacement, limping with braced knees, one leg visibly shorter. I consider myself lucky to find Dr. David and avoid all this. Thank you. I did not know Madonna had hip replacements. That's unfortunate. Wow. Well, I'm glad that you're here too. I hope we can get you feeling better. Glad you're with us, Kit Kat. Who else is here? Kit Kat is in Yorkshire in the UK. Oh, so cool. Sherry says, hello from Maryland. Great. We got the East Coast here. Diana says, I was having a really bad hip pain a few months ago, and I did some of your glute exercises, and I no longer have the bad pain. I wanted to thank you for that. You're welcome. I'm so happy to hear that, Diana. Thank you for letting me know. And I love your profile picture there. That's a very cute picture. Judy Hazel says, how do you avoid hip replacement when your doctor tells you you're bone on bone? Great segue, Judy, to what we're going to be talking about today. So let me get into it with that comment here. So today's topic is beginner glute exercises to avoid hip replacement surgery. And especially if you've been told that it's bone on bone, like we were just checking out here, Judy's comments, you can depressurize your hip joints, because that's what causes hip arthritis is extra pressure in the joint from muscles that are not working right. It's usually muscles in the front side of the hip that are overworking, and they're compensating, they're overworking because muscles on the back side of the hip, the glutes usually, are not strong enough. And glutes should have enough strength in order to balance the forces of muscle strength from the back to the front of the hip. But if that backside, those glutes, those butt muscles are not doing their job, your body just figures out a way to get things done. And usually it's the hip flexors, the psoas, the iliacus, and the rectus femoris muscle, to be specific. Those three muscles like to over control the situation. They like to take over for weak glutes. TFL is another one, the tensor fasciae lata muscle. You don't have to know all these muscles. You just need to know that they're on the front side of your hip. And so when they start to work too much, they compress the ball and socket joint. And over time, this is how you develop arthritis. So it's a pressure problem. And that's how we need to decompress the hip joint. But the way we decompress it long term so that you're not dealing with hip arthritis is by training glute muscles, by getting those glutes to turn on, and then to get stronger, and then eventually to continue to use them throughout the day. But there's a big problem that I find in people that are just starting to figure out how to fix their hip arthritis for the long term. And that problem is why this first exercise is a priority for most people. At the beginning, the main thing we have to do is go through activation. What I mean by this is you might not even be able to activate your glutes. Now, if you can close your eyes and make your butt muscles tighten up, and they tighten up when you tell them to, then you're a step ahead. But if you're in the boat, if you're in the group of people that you tried that just now, you closed your eyes and you thought, okay, butt muscles, come on, tighten up, squeeze. And the butt muscles didn't really do much, but your thighs kicked in quite a bit, then you have an activation problem. And the first exercise that you need to be worried about is just making your glutes activate. So I'm going to take you to my table over here, because the first way we do this, there's three ways. I have three ways because not every way works perfectly for everybody, but this one that I'm going to show you first tends to work best for most people. You just got to sit down somewhere, And ideally have your feet touching the ground. So my feet are flat on the ground right here. And I'm sitting kind of close to the edge. It's okay if you're not perfectly on the edge. There isn't a lot of magic to how you're sitting. Just be comfortable. Then what you want to do is think to tighten your butt muscles. So I'm going to put my hands on my hips, on the back of my hips, on my butt muscles, and then think about tightening them up. And what you should see is what happened to me here is your knees might want to move outwards, because when your glutes tighten, it should pull your thigh bones outwards like this. So your knees will open up. If you can tighten your glutes like this, hold it for 10 seconds. And during this 10-second count, this slow 10-second count, what I want you to think about is not using these thigh muscles, keeping these thigh muscles relaxed, especially on the front of the hips and thighs, all the way up into the hips, but also on the back of the thighs, down here in the hamstrings. After 10 seconds, relax, and then try it again. Think, you might close your eyes, put your hands on your backside and on the back of your hips, tighten those muscles. You might feel your body slightly elevate a bit, because when the muscles thicken, your whole body will come up a bit. And then hold it there for 10 seconds. And you're trying to activate only to the intensity at which you can work without your thigh muscles working. Let me say that a little bit differently. If you tighten your glutes and your thighs activate right away, you're tightening too much and you need to back off. Think of it this way: on a 0 to 100% scale, you need to identify at which point on that scale, what percentage your thighs begin to activate. And so go slowly on this next rep. Tighten, tighten, tighten. Tell yourself 10%, 20, 30, 40, 50%. If at 50%, we'll say, you feel your thigh muscles starting to work a bit, stop and just back off a bit. Go down to 40% and hold your glute tightening at 40%. And think, be mindful that your thighs don't come on, that they don't activate too. And just hold at 40%. This is the first exercise. Glute activation at the right intensity for you to not take over with your thighs. That's the most important thing you could be doing at the very beginning. Now, let's say you actually can activate your glutes on command. I still want you to go through this, because let's say you can activate your glutes and get to 100%, hold it for the 10 seconds. And if you feel your thigh muscle starting to kick in, not good. You should be able to get into the 90 to 100% range on your glutes, activating your glutes, tightening your glutes, and your thighs maybe barely kicking in, if anything. It's okay if they kick in a tiny bit near the end, near 90 plus percent. But if you're at 50%, 10% glute activation and your thighs are kicking in, not good. What this means, let me just come back over here. I want to look you in the eye. What this means for you, if you're watching me for the first time and you're thinking, oh my gosh, I can't fire my glutes, the implications are enormous. Because if you intend to do a glute exercise, let's say you're going to physical therapy, let's say you're watching videos on YouTube here, you're on Facebook and you're looking up videos, or on Instagram, and you're trying to do a glute exercise, what's supposed to be a glute exercise, but you haven't gone through activation like I'm telling you to right now, and you try to activate your glutes by doing some bridge exercise, we'll say. And if you are doing that exercise kind of intensely, 50% or more, your body's going to compensate really fast and go to using your thigh muscles, your hip flexor muscles, and skip using your glutes. And if you train like that on a consistent basis, if you do that for days, weeks, months, you're training yourself into a worse muscle imbalance. And over time, this progresses hip osteoarthritis. And you may not feel worse right away. Some people do. Some people will say, oh, wow, that makes my hip hurt right away, the first round of exercise they do. But many people don't. They don't feel it until weeks or months later. And they don't understand why that's happening, despite them doing these exercises that are supposed to be good for them, even those recommended by a physical therapist. But what was missing is that you never went through proper glute muscle activation like I just showed you. All right, now that was one. So let me just do like a little A here. And that was sitting. We're going to do lying next because maybe sitting didn't do it for you, but let's do it lying down. And you can lie face up or face down. Let's start with face up. What I recommend you do is start with your legs flat, just like I am right here. Then you might put your hands under your bottom. That helps because when you can feel your muscles in your hands, you just get a better feedback connection so that you can understand what's happening better back there. Then tighten those muscles and you should feel them tighten under your hands. You should firm up, hold it for 10 seconds and try to keep these thighs from tightening up. And if you feel that your thighs straightened out, your knees straightened out, that means your quads are working not good. You want your glutes to engage and your legs to be relaxed. Hold it for 10 seconds. And after 10 seconds, you can relax. And I'll tell you more about why 10 seconds is so important. It's actually really important. Then repeat it. Do 10 seconds. Hold the glutes tight. You can put your hands back there. After 10 seconds, relax. And you can keep going. What I want you to figure out, though, if you're doing these exercises for the first time, or if you're circling back and making sure you have this, I want you to figure out which one is better for you, sitting or lying down. I'll show you standing here in a moment too. But you need to determine which of these positions makes your glutes work best. And what should happen over the course of a few days, at most a few weeks, is you should begin to get better control over your glutes. And remember I said to tighten at 20%, 40%, whatever percentage you work at best. The next day, even later on in the same day, you might find that if you were at, let's say, 20% before your thighs kicked in on day 1, day 2, you might get to 30 or 40%. By day 5 or 6, you might get to 70 or 80%. Work at the percentage at which you can fire your glutes without your thighs taking over. But it's okay if your thighs activate a little. I need to say that because I'm not saying you should 100% only have glutes fire and nothing else. That's impossible for the most part. It should just feel like you're really biasing your glute muscles. Okay, now I'll show you standing in a moment, but I want to talk to you about that 10-second hold idea. I'm going to draw you a picture that's really important. So in your muscles, let's say these are muscles here, muscle cells. They're long like this. And let's just say this is your glute. I know it doesn't look like a glute exactly. I'm a terrible artist if you can't tell. But you have a bunch of little muscle cells in there. And you might only have 1 or 2 of them active for you if you can't fire your glutes very well. The body's really incredible. It's so smart. God did amazing things when he designed it. If you don't use a muscle very well, your body will say, well, why don't we just go into low power mode and shut down the ones that we're not using and run at a minimal efficiency level, at a super efficient level, so minimal use level. So you'll just have 1 or 2 fiber. We'll say 10, 20%. It's hard to know exactly what. I'm just giving you some numbers for the sake of the idea here. Well, then you have nerves that come from your brain and they come down and they attach to all the muscle cells. And when you tell your glutes to work, the signal travels from your brain down that nerve, and where it connects to the muscle, it tells the muscle cells to wake up. You haven't been using your glutes very well, if you've been very compensated by using your hip flexors too much, this connection from your brain down your nerve to the muscle is not good. It's poorly used. And it takes some time, some repetitions to get this to improve. Doing the 10-second hold continues to send the signal down more than just for a quick moment. Like if you're just tightening your glutes and then relaxing for a moment, you just get one quick signal. But if you tighten your glutes and hold it and concentrate, then you're getting the signal repeatedly sent down the nerve to the muscles. And then that one muscle cell that's been kind of working for you, not really working really, it starts to get the message that says, oh, wow, we need to work. And it starts to nudge its neighbors, all the neighboring muscle cells. And then it says, hey, they're calling us. We need to get working here. So then all the other muscle cells eventually start to wake up. And what happens over the course of a few weeks is you get a better muscle contraction because all the cells are now woken up. That's why it's called activation, and they're better used to firing on command when you make them. And this is what's necessary to go through before you start to strengthen your glutes aggressively using glute exercises. All right, this is a big deal here. Now, there's a lot to talk about here. You guys might have some questions already. Before I go into the standing one, let's see what comments you guys have so we can make sure to clear things up and get you guys helped out here. Right, who's got a question? Cindy says, I missed a little of what he said. If we are firing our thighs, then are we causing more damage? Great question, Cindy. If you are trying to fire your glutes and your thighs work more than your glutes, slowly over time, you're going to increase the pressure in your hips and your knees and set yourself up to have worse pressure, possibly arthritis in the joints. So the goal is to make your glutes work harder than your thighs. Hope that clears it up for you, Cindy. Marcy Crow says, not sure you are causing damage, but we are working on glutes, not thighs. Yeah. Yeah, if you have pain, especially right now, like if you have hip pain, knee pain, back pain too, because the same muscle imbalance affects all three of those areas, it will gradually make it worse. It may not make it worse right now. Think of it this way, like if your tire pressure in your vehicle is low, you can still drive around, but you're slowly wearing those tires out inappropriately, and eventually you're going to have a flat or something happen that wouldn't be desirable for you. It's the same thing. You're going to eventually cause some serious situation. And what we want to do is make sure that the pressures are right in your joints, just like we need to make sure your tire pressure is right in your vehicle so that you can, so that it can work the way it's intended. Hope that helps you out. Julie Parker says, I hold mine for 60 seconds. Yeah, that's, 10 seconds is the reason why I said 10 seconds is because there was a study done. This whole concept this is called a motor neuron. You can look this up. You don't have to know this, but I'm just, for the sake of Julie here and the explanation, there's something called muscle tetany, Tetany. You can Google this. And what they found through research is that when the signal travels to the muscle for 9 seconds or more, you get a more efficient contraction in the muscle. So I just say go 10, because most people count a little fast anyway. But if you can go more than that, then you're just getting more signal. My only concern, Julie, is that you aren't also firing your thighs, because if you're trying to hold for 60 seconds and you make that the goal, and if you're not focused and paying attention, which I'm sure you are, you could do this. But if you're just trying to go for the 60 seconds as hard as you can, everything starts to fire. And we call it a co-contraction, which is not good. That means that you're firing your thigh muscles in addition to your glute muscles, and we're not biasing anymore. Just be careful for that situation. But I'm happy for you to go past 10 seconds as long as you're controlling the contraction and keeping it in the glutes. Good comment there, Julie. All right, we got a two-part comment. Cindy says, I wonder if I am not progressing because I am tightening too hard and the thighs are still firing. Yes, but my thighs are super, super tight. Yeah, that's very much a possibility, Cindy. You are probably working both muscles. You're co-contracting, like I was saying. And so you're getting part of it. You're getting your glutes to work, but you're not getting your quads, your thighs to calm down. And so you need to play with that percentage. Like I was saying, if you're going 100% on your glutes, but then your thighs are also firing 100%, that's not good. You're strengthening both muscle groups. You're in an imbalance likely, but you're just strengthening them all together, and they're going up together at an imbalance. What we need is for you to get those glutes up, and so don't fire the quads so much. The glutes can get stronger. Then once you're in balance, we can work everything together, and it's not that big of a deal. Cindy says, so should I just really be doing like 5% tightening, then work up? I have just been doing 100%, causing all to fire. Yeah, I tell people go to 1%. It might mean that you barely do anything, and that might be your starting point. That's okay. You might fire your glutes at 1% because you're waking up this nerve that connects to the muscle, and that's where you're at right now. And don't beat yourself up if you're not able to do glute exercises like everybody else is, like the bridges and the squats and kettlebell swings and all these crazy glute exercises that you see. I'll show you a few of them, but understand that none of those exercises matter because you're going to do them incorrectly if you don't go through this, Cindy, and everybody else listening who's in Cindy's position. You have to figure out how to get your glutes to fire biased, how to get them to fire more than anything else. If you don't figure this out, you're starting off wrong for everything else. It's going to fail the rest of your hip arthritis recovery. Good comment there. Good realization by Cindy. Karina says, "Hi, Dr. David. I have squeezed my glutes many times, but that's very hard and get them relaxed after squeezing. What am I doing wrong?" Karina from Sweden. Oh, so cool. Sweden's here. "I have squeezed my glutes many times, but that's very hard and get them to relax after squeezing." I'm not sure what you're doing wrong here. It sounds like you're doing things right. If you're making your glutes work over and over again, you're saying it's hard, so you're struggling. That means that's good. And then you have to get them to relax afterwards. Okay, that's fine. I'm not sure what's wrong. If it's because you're not improving, my hunch is that maybe you need to do more. I think that's something that people don't realize is, okay, you fired your glutes now. You can make your glutes work. What next? Now you need to strengthen your glutes. You need to get more reps. You need to make your glutes tired. You need to practice doing exercises that tire your glutes without tiring your thighs out too much. That might be where you need to go. Callie says, "If one leg is shorter, is it possible to activate standing?" Yes, it absolutely is. If you have one leg that's physiologically shorter, like it's known to be shorter than the other, you can still activate both glutes just fine. You just need to work on it and practice it. If you have one leg that's shorter than the other, you have probably developed some compensations as a result of having one leg shorter than the other, which is natural and normal. I would expect that to happen. But I would still force your body to make both glutes work. You're always going to feel, though, that one glute works more than another, one works less than another. Everybody's like that anyway, even people that are symmetrical. Just be okay with that happening. You might feel that the right, for instance, works better than the left. But if you can still make your left glute tighten and your quads are relatively less tightened, your glutes are working most, then you're in good shape, and I would still continue. And even though you have that leg length problem, don't let it define you. Don't let it be the thing that you blame on hip arthritis, because you can get so strong, even with the leg length discrepancy, that you make that leg length problem irrelevant. Your glutes are so strong that it doesn't matter that you're 1 inch shorter than the other side or 2 inches shorter than the other side. Sure, you might need a lift, you might need a special shoe, you might need accommodations here or there, but that doesn't mean your hip has to hurt. But if you tell yourself, well, my hip's hurting because of my leg length problem, and then don't work out, I think you're living a lie potentially. And you could be working out and improving the situation despite having the leg length problem. So don't let that be the main thing that slows you down. You can still get stronger. Great. All right, let's keep going over here. Good questions we're spurring here. I love that. All right, C would be standing. So we're still on glute activation. It's so important. Remember what I was telling you here with the nerve signal traveling from your brain telling your muscle to work. The signal travels down the nerve from the brain to the nerve to the muscle. And if your muscle isn't very active, your glutes aren't very active, then you have to hold a 10-second contraction so that the signal keeps coming and wakes up all the cells. And you'll feel it. If you've done this and paid close attention, you will feel the muscle get a better contraction with each rep that you do, that you hold for 10 seconds. And then before you know it, you're able to get a full-on 90, 100% contraction. All right, so we did sitting, we did lying down. Oh, before I forget, lying down, face down is an option. I've had a small percentage of people that cannot fire their glutes sitting, standing, or lying down face up, and I'll put them on their stomach like this and then tell them, all right, tighten your buns here and it works for them. So it's that easy. You just tighten your glutes here, then relax, hold for 10 seconds. You can put a hand back there if you need to, and then relax. It's that easy. It's very straightforward. Now with standing, you want to have your hands on your hips back here, just for the feedback. That's all that it's there for. And then you're going to do the same thing, tighten your hips, and you'll notice my hips move forward. It's a hip thrust type motion because those glutes, when they tighten, they thrust your hips forward, and then hold it for 10 seconds. And you're just thinking about making this hard, feeling it firm, and concentrating on not letting these thigh muscles kick in, back or front of the thigh. The other thing, if you look at my knees are slightly bent. They're straight but unlocked. Locked would be straight like that. Some people can go back even more, but you don't want to have that, because if your knees are straight locked, that means that your thigh muscles have to kick in to hold your legs straight. But if you keep your knees a little bit bent like that and then tighten the glutes, it should feel like your glutes are doing most of the work back here and your thighs are minimally working. Definitely way more back here. It should feel like 80-20 or even 90-10, and hold for 10 seconds because we got to get that motor unit to work, and then relax after 10 seconds. And then same thing, hips move forward a bit, knees stay relaxed, slightly bent even, and you're holding the glutes here for 10 seconds. And physical therapists will have all kinds of funny sayings. Like they'll say, pretend like you're holding $1 million bill, between the cheeks, and squeeze as hard as you can. And those are all good sayings. What's the other one? Pretend like you're trying to hold on to a nickel, or they'll make, they'll find thin things like you got a winning lottery ticket, and if you can hold on to it with the cheeks, you get to keep it. They'll say funny things like that, and that's all fun and all. But the main idea is that you get those glute muscles, the meat of the glute, to begin to tire out, to feel a little fatigue. If you can get to that point and keep the quads, the thighs relaxed, then you're doing good on activation. That's what you need. All right. So that is the number one beginner glute exercise to avoid a hip replacement surgery. If you don't do this, you have no business going on to anything else. You shouldn't be trying to walk for exercise. You shouldn't be trying to get on a bike for exercise. And people are going to tell you this because that's where the research is right now. The research is saying, well, people that walk more and bike more tend to feel better in hip arthritis. But it doesn't solve the root problem, because you're biking and walking without using your glutes. We're going to talk about that before we're done today. To start here, then that sets up the stage for everything else to improve after this. All right, number 2 here. Now we get to bridges. This is often where people start when doing glute exercises, is bridges. You'll find this exercise all over the internet. Your physical therapist might have you do this exercise. I teach you the specific way, assuming you know how to activate your glutes. That's the big difference that I have with this exercise, is I assume that you know how to fire your glutes in activation, and I cover it with people like I just did right now. So come on over here. I'll show you what I mean. So when you lie down on your back for the bridge is where you're picking up your hips from this position. You lie on your back with your knees bent, feet flat, and just a comfortable amount of knee bending, whatever's fine for you. And then I do encourage my patients to open their feet up a bit rather than keeping them together, because when you have your feet open, that tends to open the knees, which better positions the glutes to want to work. You set yourself up to work better. I still want you to put your hands back here for that feedback. That feedback is so important. I mean, why put your hands here? If you're learning how to fire your glutes, you're trying to fix a hip arthritis problem, your hands are one of the most sensitized parts of your body. You feel everything with your hands. Why not put them on the muscles that need the feedback? Put your hands back there. Then before you even lift, tighten the glutes. Just make them tight. Make sure your glutes are active before anything else. I haven't even lifted my hips yet. I'm just tightening my glutes and getting feedback from my hands. Then after you're certain the glutes are active and you're not tightening up in your thighs, back of the thighs, front of the thighs, Then start to lift and just lift up a little bit, an inch or two. Hold there for 10 seconds. And I want you to, again, focus on using your backside, your glutes, and making sure that your thighs, front and back of the thighs, are not kicking in, not taking over. They might kick in some, but they're not taking over and doing more work than your glutes. After 10 seconds, come on down, relax. You should have gotten a good glute activation on that bridge. Then on the next one, you have permission to go up higher, but go through the same process. Tighten your glutes, your hands are feeling it. Then start to lift up slowly. Then go as much as you can comfortably go before you start to feel a big stretch on the front of your hips and thighs or other muscles working. You should still feel like your glutes are doing the biggest part of the lift here. After 10 seconds, you can come on down and relax. And then now you have your level at which you want to work. So glutes tight, lift up, get to the level that you feel your glutes working pretty well. Hold it for 10 seconds. No reps yet, because we're trying to get that nerve that connects from your brain to the glutes to be solid, to work on command, to have a good connection. So you don't need to go up, down, up, down, up, down, like people will teach you to, assuming you know how to fire your glutes, but you really don't. You haven't gone through that process. We're going through it right now. After 10 seconds, you can come down. And you'd be surprised. People will do 3 or 4 reps when they were used to doing dozens. And after a few reps, you're like, whoo, it's burning now. Because you actually targeted. That's a big deal. You need to be targeting the glutes when you're intending to do a glute exercise. So many people do a glute exercise and miss the glutes completely. They don't target. It's easy to fire your hamstrings, the back of your thighs in this exercise. Even your back muscles, your lower back muscles can overtake your glutes because the back muscles are neighbors to your glutes and the hamstrings are right below your glutes. The glutes are between those hamstrings and the back muscles. All 3 of these muscles can work to do this lift, but you want to make sure your glutes are doing the main work of this lift. All right, after 10 seconds, relax, and then check. See, I'm repositioning my feet. I'm going to check if I can get a better glute activation, if my feet are a little bit closer, and also my knees are wider. I have found women, especially women with larger hips, tend to do better with their knees more open. Something about the body shape. Find the position at which your glutes fire most, whatever that is for you. Some people truly are better with their feet closer together. You find what works for you. Just make sure that it's glute activation, not hamstring activation. All right, now I'll tell people do 10-second holds 10 times every hour. As you get better at targeting your glutes, then you can do 30, 40, 50 reps holding for 10 seconds all together. You can do sets of 10 or take breaks whenever you want. I think it's good to even work your way up to 70 or 100 reps. The focus is getting your glutes stronger without strengthening other muscles. And before we even hang out here on bridges, if you cannot fire your glutes very well, don't progress to bridges and just stay on glute activation and seated. Like I showed you in seated, in lying down or in standing up, and do 10-second holds, 10 reps all together, back to back. And then do that hourly throughout the day. Hourly throughout the day. Let me emphasize that. Hourly throughout the day, because you're trying to get that connection to go. And if you just do this once or twice a day, it is not enough. And you cannot expect to get better glute activation at the scale that you need to, at the amount that you need to, if you're only doing a set in the morning and a set in the evening. That's not enough. Because then think of all the steps you're taking throughout the day as you go through life, maybe other exercises you're doing. All those reps that are not good glute reps are just erasing those 2 sets you did here and there. So it needs to be frequent throughout the day, hourly. Even this bridge I would do hourly throughout the day while you're getting your glutes activated so that we can get that muscle balance corrected. All right, that's bridges. And we don't go to reps of bridges, like where you're going up, down, until later in the program, which, by the way, let me mention the program. So if you have hip arthritis, we have a program called the Hip Arthritis Recovery Program, which walks you through every step as if I was there with you. And my team is here to help you along the way. We use this chart here. These are the 4 phases of hip arthritis recovery. And if you're in phase 1, maybe phase 2, this is where you're going to be doing these beginner type exercises. There's certain criteria that tell you which phase you're in. And based on the phase that you're in, there's certain treatments and exercises that you should be doing. And this is really important because a lot of people are trying to do very complicated exercises to help their hip arthritis. And that's a stage 3 or 4 exercise. But you actually qualify to be in phase 1. That good exercise for later is actually going to harm you right now because you're in this lower phase. So just make sure that you understand that there's good exercises to do at the right time. And these that I'm showing you today are intended for when you're early on, when your symptoms are worse, when your hips really bothering you. That's when you need to begin to activate your glutes very often. Now, we have phase 1 of the hip arthritis recovery program completely free right now. The rest of it's on a membership. You have to apply and then join our membership to get full access to everything. But if you go to our website, check this out here. You can do it on your phone. You can do it on your computer. The videos are right there. You can just hit the play button on the video and start watching the first video and scroll through the videos there. There's a few to watch. And if you want to get to the whole program, you can apply. But phase 1 is there without having to apply, without having to set up a login. There's no payment necessary. You just start the videos and you can start learning all the videos in phase 1. That's a good way to see if this program is right for you as well, in case you're considering joining, but you're not sure. And once you do join, we'll do a 5-minute safety interview to make sure that you're safe. And then we'll discuss if we're the right fit for you, for your specific situation. And we do that all over the phone. So hope you guys can benefit from that if it's right for you. All right, we talked about bridges. Let me get a swig of water. And then we'll go to number 3. It's going to get a little more intense now. Number 3. This one's called a butt burner, also called a fire hydrant. You may have seen that one. So this one does require you to be on your hands and knees. I'll show you a standing version here in a minute too. You're going to be on your hands and knees. You could be on your fists. I prefer fists. It's just better on my hands, but people can be flat-handed too. It doesn't matter. Then what you have to do is pick up a leg straight up towards the ceiling. Your foot's going towards the ceiling, and you're thinking about tightening the glute of the leg that you're picking up. So in this case, it's my right leg that I'm picking up. I'm going to tighten my right glute. Go as much as you can without arcing your back or twisting your body. You want to think about keeping your spine nice and straight, nice and stable, nice and motionless, and just tighten the glute. And then there's a little tweak that I want you to put at the end. I want you to move your knee out a bit. So I'm moving this knee just a little out, and then I'm going to turn my toe up towards the ceiling. So watch. Leg back, foot up, knee out, and then turn my toe up. And that little tweak at the end with my knee and my foot, it makes that glute just turn on, activate really well, right in the meat of the glute. And then you're going to do a 10-second hold. And the focus here is to make your butt muscle burn on just that one leg that you're lifting. Everything else is kind of just holding. And then after 10 seconds, you can come down. And then I want you to switch sides. You can do the same side if you want, but you might want to give it a break because it'll burn pretty well. Then bring your foot up, knee out, toe up. Think about bringing your pinky toe up to the ceiling and then hold it for 10 seconds and make your butt burn. You should feel like your glute muscle is just working hard to hold your leg up right here without your spine twisting or turning. After 10 seconds, come down. And what I want to emphasize here is that what's most important is that you get the burn, not that you go as high as you can. Because I see people that are trying to do this. Watch, I'm going to go as high as I can. And you see how my head comes down, my back arches. That's making sure that you go as high as you can. I want you to burn the butt, which means I'm not going as high as I can. The knee position can vary. I've had people stick their leg out all the way. That's fine too. Just as long as you feel like you're making your glute work most. For me, this is the best for me. but I've seen some people do it with their leg more straight or bent all the way too. As long as the glute's working, that's what matters the most here. 10 seconds, and then do the other side and hold that one for 10 seconds as well. And what I would recommend with this one, by the time you're doing this exercise, you should have already been activating your glute. You should feel like you have good glute control. You've tried sitting, standing, lying on glute activation. You're pretty, what's the word? Competent. You're good at firing your glutes on command. You can do bridges. You've been successful at bridges. Then butt burners would come into play. So these are truly in order. I would not start at butt burners if you're trying to activate your glutes and your thighs take over. I wouldn't even do bridges either. All right, we have a comment I'm going to take. Uh-huh. So in case you can't get on your hands and knees like I was, what do you suggest? Yeah, let me show you. Julie Parker's asking. Great. I'm going to use the walker just because I'll use both, actually. Let me start on the table. If you can't get on your hands and knees for whatever reason, find a table, a sturdy piece of furniture. You could even use a wall. And you're just going to lean on it for balance. And then you do the same exact thing. Just come out, turn my knee out, pinky toe up towards the ceiling, and make that butt muscle tighten up. Hold it for 10 seconds. Think about making that glute work. Same thing going the other way. Just leg as far back as it'll go to tighten the glute. Knee out just a bit, toe up. Hold it for 10 seconds. I'm leaning on a table. You can lean on whatever you find that is sturdy. I've used a walker before to do this one. Just straight back, knee out, pinky toe up towards the ceiling. And I'm thinking about tightening this muscle right here. Let me show you with a wall. Can we have a, maybe you guys can get that shot. Can you see me over here? I'm using the wall, same idea, just going back like that. So you could do this standing, and it burns still. It's just that when you're on your hands and knees, you have gravity on your leg a bit more. It's a little more intense, but you might not need that intensity. Standing might work just fine for you if your glutes are very weak. Hope that helps, Julie. That's a good question. I don't think everybody can do this exercise kneeling, because some people have knee arthritis in addition to their hip arthritis or other knee problems, meniscus tear. All right. So we're still going here. Number 4. So we did the butt burners. We got 2 more. Number 4. Now we're going to get to mini squats. That'll be the last one. Once you get through these 3, mini squats is usually the next progression. Occasionally I'll have some people jump and miss the butt burners and go straight from bridges to mini squats, but it's the same idea. Let me show you the mini squat. Very straightforward. The key again is that you have good glute activation. So you're making sure in standing, you're doing the standing glute activation. You're making sure your hips go forward, glutes tighten up back here. Then remember, your knees are a little soft. Your knees are slightly bent, unlocked, if you will. Then all you're going to do is bend them a little more. That's it. That's the shift I made. I went from here to here. Barely anything. Because as soon as I tell people squats, especially if they have knee problems in addition to their hip problems, they go, oh no, I can't do squats. But I'm not talking, full depth squats. I'm talking just a little bend. As soon as you start to bend your knees, you're technically starting to do a squat. That's why I call this a mini squat. And you should feel safe. You should feel comfortable. It shouldn't hurt. The only discomfort that you might feel is your muscles burning from the fatigue of the exercise. All right, let me show you the back view. So I'm just relaxed. Now I'm going to tighten my glutes, hips go forward, bend my knees a little. That's it. I'm holding there for 10 seconds. Hands back here for feedback. just so that you know you're firing the right muscles. From the front, hands on the back to make sure that I'm firing the right muscles. And then I'm going to tighten my glutes. So hips go forward, drop my knees a little bit. Notice when I'm dropping my knees kind of go out a bit. That's important because what you don't want is your knees to come in. When your knees come in, these muscles will take over. But if your knees stay out and you're driving your hips forward, glutes remain more active. That's what we need. Now, what you'll find is as you practice this one, you might be able to go a little lower and a little lower. That's okay, but it's not necessary. It's not critical that you go lower and lower. The point is not to have a deep squat. The point is to have very active glutes that are getting stronger. And you can do that without dropping more than an inch or two. We have people that graduate from our hip arthritis recovery program, never, ever doing more than a mini squat and dipping this much. Because their muscle balance gets fixed, the pressures in their joint gets relieved, and they feel fine. And you can do everything with that. As long as you're not having to go back to doing activities that require you to squat like that, you'll be okay. A full depth squat is not necessary in order to fix hip arthritis. Some people will tell you that. I've had patients that have told me that the therapist wanted them to go deeper. Their trainer wanted them to do weights in a deep squat, and it just killed their hips, killed their knees, hurt their back. It is not necessary. It's possible, maybe for you, maybe not for somebody else, but it isn't necessary to feel better. Just want to stress that point. Mini squats, the way that I'll do them, as far as reps, hold for 10 seconds, count real slow, 10 seconds, and think and concentrate on the glutes activating. All of this is isometrics because we're trying to get this connection and improve. That's what needs to happen when you're a beginner. There's a whole other video we can do for advanced stuff, but we're not doing it today. Everything here is going to be holds except number 5 here. Before we get there, let's see what questions you guys have so that we can get into number 5 clearly. Julie Parker says, why does my physio tell me pointing my toes about a bit is wrong? Pointing toes out a bit is wrong. I'm not sure. I think pointing toes out is good for the most part. There could be exceptions though. So what Julie's talking about here, if you look down at my feet, when you have your toes pointing, can you see my shoes? Yeah. You see the red tips of my shoes here? When you angle them out subtly like this, it puts your glutes in a better position to activate. If you have your toes, let me go straight forward. That would be about straightforward right there. Straightforward is okay. Inwards is bad in my opinion because it lengthens the glutes and makes them want to work less. But a little toed out is ideal because it shortens the glute. Let me just show you on the skeleton what I mean by lengthening and shortening the glute. The glute would be back here on the back of the hip, and it starts on the rim of this bone, goes all the way down to the tailbone, and then it covers this area and attaches out to the side of the thigh bone up here. That would be the glute area. Now, when your foot rotates in, what happens up here at the hip joint is the bone does this, and because of the attachment, it elongates the glute. And when a muscle's elongated, it's in a less likely position to work. It's at a mechanical disadvantage. It's not going to want to fire. And if it's not ready to fire, that's when other muscles start to take over. But if you rotate your foot outwards and it moves this thigh bone into this backwards position, which shortens the muscle and puts it in a mechanical advantage to fire, it sets up your glutes to work right. The exceptions might be is if you have a tibial torsion or a femoral torsion, that means that your bone here in your thigh or your shin bone is genetically a little twisted. And you would have known this as a child. You would have known that like your feet, you're really, really toed in or really, really toed out. It just depends on your genetics. But the majority of people are going to benefit from having their toes a little turned out to shorten their glutes and have them better activate. Very, very important. Now, going back to Julie's question, This concept that I just shared with you about the glute shortening when your feet turn out is not a mainstream medicine accepted concept. In fact, they don't really have a certain um, explanation for toe in or toe out. It's all over the board. What I've heard is the leading concept, and it's not leading by much. There's a lot of competing concepts as far as toe in and toe out, and if it's better or worse for you, if it's an advantage or a disadvantage for you. The leading concept that I hear is that if you're a little toed in, I don't believe this, is that you're more likely to have better power or strength or be a better athlete. And the reason why I think they believe this is because amongst competitive professional athletes, you see this happen. They walk toed in and they associate that must be a good thing because they're professional athletes. The way I see it is that professional athlete has a muscle imbalance and they're just a genetic freak. They just happen to be very fast, very strong, can jump very high, they have a skill at their sport that they're very good at, but that doesn't mean that they're a perfect anatomical specimen that we should all follow. We're all different. And when I see individuals in person in my office and I look at as long as they don't have a torsion, like I said, those are the exceptions. Usually a little toed out is what will get your glutes to fire. And you can tell on your own. If you stand up wherever you're at and just stand the way you normally stand and then tighten your glutes. Don't worry about your feet in or out. Just make your glutes tighten up. If they tighten up, good. Now turn your toes in maximally or a comfortable amount. So my toes are in. And then try to tighten your glutes. They'll tighten, but not as good because you put them at a mechanical disadvantage. Then turn your toes out. Not all the way, or you could go all the way if you want, but just relatively out and tighten your glutes there. And they turn on right away. They turn on good. So that's a little quick test. You could try on yourself just to prove the point. When I do this test with physios, with other PTs out there, the light bulb goes off and they're just like, oh, wow. I didn't think about that. You're right. The anatomy lines up. Oh, that makes sense. And then very often it's followed up with, I've heard a lot of people. I've told a lot of people. So hopefully that's not what's happening in your case, Julie. Hopefully everything's going well. What other questions do we have? Beth says, butt burner isn't in phase 1. I can't imagine it yet. Should I wait? I'm at sit-ups following the program. Follow the program the way that it is. Yeah. So the videos that I'm doing here, if you're one of our members in our program, you're on the program. Follow the program. I'm giving content here, videos, information here for the general public, people that may or may not be in our program, because I just want to help you guys out and give you the concepts. But if you're in our program, follow it as planned. You're right. Butt burners is going to be a harder exercise. That's why I've listed it this way. Mini squats is also not in phase 1, and this next one's not in phase 1 either. Beth's a student here. She's paying close attention and noticing the differences. Leslie says, why does it hurt in my shin and foot? Is it because I have knee arthritis too? There's a lot of reasons why your foot and shin might hurt. The first one that I think of is you might have like some weakness in your toe muscles and you're overusing the front side of your foot. It could be a nerve problem coming from maybe a sciatica issue. There's many reasons. The first thing I would look at is if you have these muscle imbalances, like I talk about, like weak glutes, you have weak abdominals, weak toe flexors, I would start with fixing those because that's probably going to be the source of the problem. 9 out of 10 times, a lot of these issues that happen from the waist down, even in your low back, it's related to this muscle imbalance where your glutes are weak, your lower abs are weak, and toe flexors are weak. And when we start fixing that, it solves a lot of issues. I hope that gets better. Trader Athlete says, how many reps of 10 seconds do we do for activation? Great question. I give ranges here. So let me give you the specifics, and then I want to give you the guidelines, because it really depends on the individual. Some people can't do 10-second holds. Some people can't do 1 10-second hold. They start getting a cramp or something starts to hurt, and you should stop if that's your issue. Hold for 3 or 4 seconds, whatever you can. As you get better at it, you should eventually be able to hit 1 10-second hold. And what I ideally want you to get to is 10 reps of a 10-second hold. So hold it 10 times, 10 seconds each time you hold it. And that would be one set of 10-second holds. If you can do that without something hurting or cramping, now you're making some good, you're getting momentum, you're making some good progress. But then you've got to work to doing that hourly throughout the day while you're in the activation part of beginning glute exercises. Once you've gotten this down, then you can move into the other ones. And I would still be doing 10-second holds 10 times on the bridges hourly throughout the day. Because if you have hip arthritis, you've been dealing with a muscle imbalance for a long time, and we need to make some massive progress as soon as possible. And why are we going to wait? Why not do it hourly? As long as it's reasonable for you. You know, sure, I understand if you have to go do something, or if you have a job or an appointment, or you're just not in a position where you can do the exercise. But if you're doing this 8 times a day, 10 times a day, 12 times a day, that's good progress you could be making. Why limit yourself to once or twice a day? Go 10 times a day. Same thing with the butt burners. I would do 10-second holds 10 times each side every hour, as long as you can humanly do it. You will notice a massive difference in your hip pain if you can work at that often. Now, as you get better, let's say you have been doing it every hour, whatever exercise, you've been doing 10-second holds 10 times, which will take you a few minutes, it won't take you that long, and you've been doing it every hour for the most part. Once you get into phase 2 of our program, this is where we talk about once you're in our program as a member, giving you the phase 2 secrets here, we start to chunk them down into a workout, if you will. Like we'll do 50 reps in one sitting, 100 reps in one sitting, and you'll get a big burn during that time. But we're still doing it daily because we need more volume to tire out the muscle, to get it to fatigue, to go through the chemical processes that will build your strength. But before we get there, we have to just activate it. And that might mean you need to be doing it frequently throughout the day to get the wiring to improve. I hope that helps you out, trader athlete. It's not a clear-cut number. It depends where you're at. It depends what you can tolerate without making things worse. Dr. Lyons says, it seems that when tightening and relaxing the glutes, it helps to do the same with the lower abs. Yes, good observation, Dr. Lyons. I haven't mentioned that yet, but the lower abs work with the glutes. Let me show you on the skeleton, because you guys are probably going to run into this if you haven't already, like Dr. Lyons is running into. When you tighten those glutes on the backside of your hips, it tends to pull, this is your pelvis, it tends to pull your pelvis this way. If you're tipped forward, let me show you on my body. So if glutes are relaxed, your body's going to want to stick your butt out a little bit this way. But then when you tighten your glutes, you do a forward hip thrust motion, which makes the skeleton do that right there. And when you do that, the lower abs connect to the bottom part of the pelvis here. They'll want to contract to assist in tipping your pelvis this way. We call this a posterior pelvic tilt in the medical world. And so my abs right here, when my glutes activate to shove my hips forward, my lower abs also activate here to pull the front of my pelvis bone upwards this way to accomplish that hip thrust motion. So they work together. They're synergistic muscles. They're supposed to be working at the same time in order to accomplish that motion that we need in the pelvis, that posterior pelvic tilt. So I encourage the lower abs to feel like they're kind of working too. It's just you still want to bias the glutes. And it would be good for when between the reps, between those 10-second holds, for you to just take a quick breath, relax everything for a moment before you get started with the next rep, so that you don't carry over a contraction that's going to maybe turn into a co-contraction when you start to fire all the muscles, and that's not the intention. We need certain muscles to fire so that you can target and correct the imbalance. All right. Next question. Julie Parker says, is it okay to be doing longer holds with less reps? I'm okay with it as long as you properly target the glutes, lower abs, if it's right for you. If you are holding for longer and you're finding that your glutes are not working as good, it would be better for you to take a quick break, and just start the next hold. That doesn't take you much effort, and it's worth that little 1 or 2 second rest break to get a more efficient glute activation on your next rep. Versus if you just hold for 1 minute, 2 minutes straight, you start to lose the glutes and compensate with other muscles. Whereas if you just took 2 seconds literally and then started over your contraction, you get a good glute contraction. So you can get that muscle to work. Like you need to make it work, getting the nerve to work. You need to allow the chemicals within the nerve to reset, and that 1 second will help. The chemicals in the muscle will reset, and that 1 second will help. If you're confident you can hold the right muscles working, then I'm okay with it. But I tend to prefer the 10-second hold. Kimberly says, sometimes I don't count sets or reps. I just go to failure. I love it. I love it. I think that's the best thing because, the sets and reps, the numbers, there's nothing wrong with that too, by the way, because it gives you a goal. I'm going to get in 10-second holds 10 times. But it wouldn't be a bad idea either to just say, I'm going to make the muscle burn and then go another set or two if you can, another rep or two if you can, beyond that level, with as long as you don't have any pain and you don't lose the form and you're still targeting correctly. I think that's good. Good job, Kimberly. I encourage other people to do that too. I do that myself. I'll go to the gym with the expectation. I'll say I'm going to do, 20 reps, 10 rounds, whatever it is. And sometimes I'll do 25 reps, 30 reps. I just make my muscles burn because it didn't burn on 20. So I went to 25. I went to when it burned because I'm there to burn the muscles. Good job, Kimberly. Cindy Knight says, to be positive, I can do leg wiggles. I can do the glutes, but I just need to back off percentage. So it is just doing correctly. I will keep going forward. Good job, Cindy. Absolutely. We're positive here. Don't beat yourself up. It's okay. This is a learning process. Remember, fixing hip arthritis is a process, and it requires a little bit of failure here and there. And you don't win or lose. You win or learn. You learn, and that's helpful. That's positive. So you're on the right track. It's okay. Don't throw the baby out with the bathwater. You're going to be just fine. Now that you know a little bit better, you're going to succeed. Good job, Cindy. Callie says, is it fine to do activation with hip replacements? Oh, yes. Oh, yes. It's necessary. It's not taught very often. After people have a hip replacement, the most protocols will just be get back up to walking, get to sitting and standing, get up and down from the commode because that's important. Be able to get off the walker eventually. Of course, get all your motion back. What isn't talked about is fire the glute muscles. And it's important for you to move properly so that you're not maintaining your muscle imbalance, which is likely to happen because they probably cut through some of those glute muscles to get to your hip to replace it. And you need those muscles to be active. When they cut through, especially if they do a posterior approach, they're cutting through your glute muscles. It's going to leave those muscles weaker. They're going to heal, and you'll be able to use them later on. But while your glutes are healing from your hip replacement, guess which muscles are doing all the work? Your hip flexors, the ones that are already strong. They're just going to get even stronger. So yes, you need to fire your glute muscles after hip replacement. I think everybody should, as soon as you can without causing any problems, and check with your doctor to make sure that it's the right protocol. All the doctors say yes. Like if you talk to them, they're going to be like, oh yeah, fire your glutes. Once, within a few weeks after things have healed, you're doing checkups, they'll say, yeah, you're clear. Go ahead and do glutes. But none of them will tell you need to do it. They'll just say you can if you want. And they'll usually leave it up to the therapist, which they're just making sure you can walk and get off the walker eventually. All right, Janet Clark says, my quads are in a constant state of contraction. Oof. It's very hard for me to relax them. Do you have any suggestions on how to release this muscle tension? Oh, yeah. That is a sign of an extreme muscle imbalance. You are using your quads so much that they're just constantly contracted. You get up and walk around and it's quads doing all the work. And they're not, your glutes aren't doing their job. So it's just quads taking over. You're in a tough spot. I would get to using a massage gun very frequently. If you haven't bought one, you should. Let me show you what I'm talking about. I've got a massage gun here. These are very affordable these days. I just looked at the price earlier this morning for a even heavier duty one than this one, and it was $40 on Amazon. So I'll see if we can get that link up there for you guys. But I like the Toloco, Toloco brand. I'm not sponsored by them. I bought that one before, and it's a pretty affordable, good value massage gun. This isn't it. This one's a special one that has a gooseneck for your back, but it's a little less powerful than the Toloco one. And the Toloco one has a bigger battery, so it lasts a little bit longer. It's just a good gun. But this one's pretty good too. Doesn't matter too much. They're all comparable these days. But the idea is you turn on the massage gun. This tip, you might not be able to see it as good with the video, but it's bouncing back and forth. And what you want to do for your quads that don't want to relax is find those knots, which you're going to find really easy. And you're just going to let that massage gun do its work. I'm maintaining a little bit of pressure on a spot that's a little bit tender. And after 30 to 60 seconds with the gun activating on my quad, you should feel like it's less tender. That's how you loosen up tight muscles. Then you go to the next spot and you do the same thing. You just hang out there. You can move it around, but I'm making contact on the same spot here. I'm moving in circles. You can move inwards and outwards, up and down, diagonals, do circles. What I wouldn't do is this right here. A lot of people, they want to just go all over. It kind of helps, but I think it's a lot more strategic if you find a spot and then sink into it. It might get a little uncomfortable. Just don't do it too much. After you hang out there, you should find, like I said, within 30 to 60 seconds, a half a minute to a minute, it loosens up and you should be able to find that it's softer. Now, in the case of your constant quad activation, you might need to be doing this very frequently. So that's why I think it's worth it to get a massage gun, because you could get in there with your hand. Now, you could get in there with your thumb and massage it. There's a rolling pin style tools. I've seen people literally get a rolling pin from their kitchen and roll it out. That works too. Tennis ball or a racquetball, lacrosse ball, something like that. It's just more effort because you have to move your arms or dig in there with your hands. This is easy. You just lean it on there and it does the work. You might just wiggle it around. These massage guns they used to be like $400 or $500 when they first came out years and years ago. Now you can get them for under $100 easy. $40 is what I saw recently. Here's the thing: is your quads, after you go through the massage, after you go through your quads with the massage gun, you'll feel better. You'll feel more relaxed in your quads, and because it's both in your case, and it sounds severe, it's probably going to take you a good 10 minutes. 5 minutes on each leg, maybe more. Then you're going to feel like they tighten up on you again very soon, like within 5 minutes, 10 minutes. You have to simultaneously do work to get your glutes to activate so that you can begin to get your glutes to fire when you're up and doing things. Gradually over time, as your glutes become more active, your quads will become less active and you should see them get less tight, less stiff, and you should need the massage gun less and less. But it could be months with this situation, but this is how you scratch and claw your way out of the situation. If you don't fix this, you're just compressing your knees, you're compressing your hips, you're contributing to some back problems, and this is the way that you get arthritis. So I hope that helps, Janet.
Just to clarify, you're telling people to continue using it until they're able to grow their strength up, but continue using it to loosen up.
Yes, what I'm being told here is to clarify it and say continue using the massage gun while you're growing your glute strength so that your quads aren't being overactive. Good. Okay, we're gonna take a call from Louise in Pennsylvania who's got some neck problems. We didn't even flash the number today yet. People know the number. Oh, we had it. Okay, great. All right. Hey, Louise, this is Dr. David. How are you?
Dr. David, I've been watching your show for the last 3 months.
Oh, well, thank you for watching.
Of all of the professionals that I have watched on TV, you are the best.
Well, thank you. I appreciate that. I hope it's helping you.
You're absolutely the best. I have been doing the exercise where I make a double chin and raise my arm up like 3 times with the count of 10.
Yep.
But
Great.
the doctors did a CAT scan,
Okay.
and it was I have something about stenosis
Mm-hmm.
and also arthritis in my neck.
Oh.
And so it's very painful. My doctor, knowing that I wouldn't be back down to Florida until the middle of November, he's prescribed me to take Tylenol 3 times a day
Oh.
until I get back down there.
Jeez.
So I'm kind of suffering a little bit.
Yeah, that's not a.
Yeah.
That's just kind of a hold on for a little while plan. And has he talked about
Yeah.
what's going to happen next, or is he discussing surgery or some other?
No, he didn't. He did not discuss surgery. He said after we do the MRI,
Uh-huh.
he was going to try to develop a pain management plan.
Okay.
And that's what he said to me.
Yeah.
And after watching you, I'm thinking it should be a plan where I could probably exercise or do physical therapy to
Yeah.
kind of correct some of this problem.
Right. Yep. I agree. It sounds like you're starting the right exercise. How has that exercise gone for you? The double chin and raising your arms up.
Yeah, that's the best one. That's the best one.
Great.
And I've also been doing the double chin and taking my head from side to side.
Okay. Good.
And I believe that's me also.
Good.
But some days it's worse than others.
Oh.
But I do good. I'm 91 years old. I still drive. I still clean my house.
91.
I'm still 91 years old.
Fantastic.
I do everything for myself. You know what I mean?
Yeah.
But all of a sudden, I'm getting a neck issue.
Jeez.
You know.
Yes.
So the devil just don't want to leave me alone.
When did your neck issue start? Has this been going on for weeks, months,
I
years?
would say I guess about the last 4 months.
Okay.
About 4 months.
What happened around 4 months ago? Was there? Did you have an incident? Did you wake up with this? Tell me more.
I'm trying to self-diagnose. I have been sleeping with a little teeny weeny fan in my bed.
Okay.
Because when I have the ceiling fan on or the air on,
Yeah.
I'll always wake up with neck pain. So
Okay.
I've been putting that little teeny weeny fan in the bed with me.
Okay.
And I'm thinking to myself, maybe I irritated the inflammation as the arthritis in my neck. Other
Yeah.
than that, I just do everything. I don't remember straining myself or anything like that.
Okay.
So what do you think?
It sounds to me like you probably developed a stuck joint, because if you haven't had issues prior to that time,
No.
even though you were told you had stenosis and issues in your neck, I mean that could be possible that's causing the pain. But we know by like with knee arthritis and hip arthritis, lower back problems, I haven't seen studies for the neck just yet, but there just isn't much out there. But we know that the X-rays and MRIs don't tell us the full picture. They might see that there's something going on, like something torn or stenosis, like you were saying, that happens in the low back too. But that might not be the reason why you have pain. And so,
I know him.
yeah, what I would consider in your situation is to get some hands-on work by somebody who you can trust. So I'm a manual therapist. Like if you were here in person, Louise, I'd get you on this table that I'm sitting on right now, and let's feel your neck and see what all those bones are moving like. And if we need to loosen up a bone or two, that might be what needs to happen that unlocks a lot of relief for you. So you don't need to be taking Tylenol every day. Now, if you can find a manual therapist near you, that would be ideal. But a chiropractor might do you some good too. I just, do a little research and see if you can find one that a lot of people trust and have had a good outcome with.
Well, I would prefer if someone would recommend a therapist to me in my area. I'm in the Philadelphia area. I live in Willow Grove, Pennsylvania, which is Montgomery County. I don't know whether you know anyone, because like I said, when my doctor first sent me to physical therapy, she made it worse.
Oh,
I started having worse pain.
So sorry.
So I wouldn't want to go to the wrong physical therapist.
Yeah. I don't know anybody off the top of my head, and they're hard to find, but manual therapists would be who you want to look for, though, especially the ones that are that are fellows of the American Academy of Orthopedic Manual Therapy. They tend to know a little bit more about how to handle neck problems like this. I'm going to pass you off to my staff, and I'll have them get on the Find a Fellow website with you and see if they can recommend somebody in your area. But like I said, if there's nobody in your area or you just can't get to them for whatever reason, you might find a chiropractor in your neighborhood. You know, maybe do a little Google search, ask a family or friend to help you out with that if needed, or just ask friends and yeah, find a chiropractor, and that might do you some good. But you still do need to do some of those exercises, that chin tuck exercise and with a shrug, that makes the muscles work right in your neck. It fixes imbalances. But it sounds like you just have a hitch, like you just have a joint that's stuck. And you said you're 91, which means you're probably going to have some sign of stenosis, but it may not be the main reason why you have problems.
Okay.
Yeah.
Okay.
I think you could probably fix this problem really fast by getting to the right hands-on person.
But the right chiropractor also.
Yeah, yeah. You know, a lot of them, the chiropractors are pretty good. They're pretty good at what they do. They don't always know the exercise part, but loosening up joints, they know pretty well, especially neck.
Yeah, because I hear on your recommendations that you can get the wrong chiropractor that could do harm also.
You know, it's just like any other profession out there, Louise. There's amazing teachers and there's bad teachers. There's amazing doctors and bad doctors. There's amazing lawyers and there's bad. Same thing in the medical field with chiropractors and doctor, nurses, physical therapy. It's just, you know, there's just some people that maybe picked the wrong career and they're not in it for the right reasons. But you'll know because you'll hear reviews. You'll hear people say, "Oh, Dr. So and so, they're amazing."
That's true too.
Yep.
So I wish I was in Texas.
Oh, I'd love to meet you, Louise. I wish you were too.
That's where you are, right? Okay. Well, I mean, it's just a pleasure to even speak with you.
Oh, absolutely.
Because you're on
Likewise.
my television all day long. I'm constantly watching for the hip. I felt like somebody shot me in my hip the other day.
Oh, no.
And so now I'm doing the glute exercise.
Good. Fantastic.
I think I got them down pat because I close my eyes and I make sure I just exercise the glutes.
That's amazing. That's fantastic.
Yes, that's it. I appreciate you being on the air.
Likewise, thank you. I appreciate you for joining us here live on the air as well. I'm going to pass you to my staff and see if they can get you connected to the Find a Fellow website, like I was saying. And then, so stay on the line here. We'll get you over. Thank you, Louise.
Thank you so much.
Absolutely.
Bye-bye.
All right. I love that. That's good. That's a great situation. And, you know, I don't know her. I haven't seen her x-rays. I haven't seen her eyes. What I'm working off of there, just so that you guys know, because people can say, you know, well, you didn't see her imaging. How do you know that, you know, she doesn't have a serious stenosis problem? Just listening to her, you know, this started a few months ago. Stenosis very often starts for people in their 50s or 60s. And by the time it gets very severe, they're having loss of sensation, loss of muscle strength. Like, and if it's in the neck, it's going to affect their arms. You know, I didn't ask her, maybe she has something like that, but she didn't bring it up either. But given that she's 91, and it just started 4 months ago, it's not been years with that situation. Sounds like she just has a stuck joint that she needs to find the right person to free that up. You know, hopefully she has somebody in the neighborhood that can handle it, and it, you know, it'd be worth it to even drive a bit of a distance if you know it's somebody really good that'll handle that neck situation. And that person that's going to see her in person hopefully will be able to identify if it's something more serious than just a stuck joint, and they can guide her appropriately. But those exercises that she's doing already, that's going to help her either way. So glad you're on the right track, Louise. I hope you get some relief soon here. All right, guys, we got one more exercise that I'm going to cover with you here that's very important to get to after you've been through all this other stuff here. So just to review, we're covering the beginner glute exercises that you need to learn to avoid a hip replacement surgery. Nobody talks about glute activation in the medical field. They just start you on exercises. So I made a big deal out of it. Hopefully you got the message that you need to be able to fire your butt muscles on command. And you have to not let your thighs and your hip flexors in the front of your hips take over when you're firing your butt muscles. Then we're doing bridges after that. So, well, first off, we did glute activation sitting, lying down, and standing. Then we went to bridges where you're lifting your hips, lying down on your back, and you're making your glutes work. And all this has been 10-second holds so far. Then after that, we went to butt burners. And something that I didn't mention in butt burners that I want to highlight to you now is you have to be able to fire one glute independently of the other. This is something that we teach in the program in a little more depth, but the assumption jumping from bridges to butt burners is that you can fire one muscle, one side, just the right glute, and the left glute isn't doing anything. And then you can alternate, you can fire the left glute without the right glute also activating. Because in glute activation here, you're firing both together. In bridges, you're firing both together. And even when we got to the mini squats, you're also still firing them both together. But here in butt burners, you are learning how to fire them individually. And that's critical for this last one that I'm going to tell you. You need to learn how to glute walk. What I mean by this is as you're walking, as you're doing your normal walk, as you walk through your home, as you walk through the community, the grocery store, the places that you frequent, you need to be able to use your butt muscles, your glutes during the walk. This is breakthrough. This is the first breakthrough people have to get when they are starting the hip arthritis recovery program. Then there's these smaller exercises that they have to still use and go through to get to this next big breakthrough, which is glute walking. And the reason why glute walking is such a breakthrough is because you walk all the time. You wake up in the morning and get to the bathroom, get to the kitchen, get to the things that you have to do. You go out in the community, you walk through the parking lot of places, you go through the stores. Maybe you enjoy just going on a walk just because you like walking. You have a pet that needs to be walked. You have family, loved ones, friends that you want to enjoy walking with, sightseeing. Walking is critical. If you have the ability to walk, you want to maintain it. And so in order to make your hips healthy so that you don't get a hip replacement, you need to learn glute walking. And here's the thing. The feedback is important. What you should feel when you're glute walking is that your glutes get a little tired, that they get worked out. It should feel like your glutes are getting more worked out than anything else in your legs. If you don't feel your glutes getting more tired than your thighs, for instance, you feel your thighs getting more tired, then that means that you're using your thighs more and you're not using your glutes properly and you're not doing a glute walk. You're doing a quad walk. And that's feeding the muscle imbalance for the worse. It's going to lead to you getting worse hip arthritis. This is why what I find a lot of doctors will recommend to their hip arthritis patients to start walking to get exercise to relieve the problem. No instruction whatsoever about which muscles to use and no idea about glute walking. What they're thinking is there are some studies that said that people who walk tend to have less hip pain. So they tell their patients, start walking, try to get 5,000 to 10,000 steps a day. So people go buy a pedometer, they download an app on their phone and they go on a walk and they say, you know what, I do feel a little bit better after a few thousand steps. But the research also shows, I don't think the doctors read the research fully, that once you pass 7,000, 8,000, 9,000, 10,000 steps, the more steps you walk, the worse your hip gets. Why is that? Could it be because they're not glute walking, they're quad walking? And after you hit a certain threshold, it just hurts your hip. It hurts your knees too. So you have to figure this out. And what it takes is you slowing down and being okay with looking like a goofball for a moment, for a day or two. You're going to feel like a robot as you get these muscles to work. And maybe even tell yourself, I'm not ready to do glute walking, and go back to other stuff. But once you're ready to do glute walking, here's what it looks like. Here, let me show you. Put your hands on your backside. Let me tuck in here so you guys see everything fine. Put your hands on your backside, right here on your butt muscles. And what you should feel, what you're looking to feel is the muscle tighten up when you intend to use it. So when I step with my right leg and I'm putting weight through my right leg here, my right glute should tighten up. I'll show you from the backside. So as I lean on my right leg right here, This side activates. This one's relaxed. This one's tight. Then as I step onto my left leg, I'm going to relax this tight one and tighten this relaxed one. So you should be walking, alternating your glutes. Tight right here. I'm going to step on my left, tight here. And if I step on my right, tight here. And you're just tightening, alternating contractions as you're walking. And it's going to feel awkward and like a robot because you're going to say, oh, I have my hands back here and I'm moving weird and I'm thinking a lot about the way I walk. I don't usually think about the way that I walk, but now I'm having to do it and I feel awkward doing it, but it's what's necessary. After you get comfortable with this, and what I mean by comfortable is you get the idea, you get how to, you coordinate this. You are firing your muscles at the right times. When you're bearing more weight onto the right foot, the right glute should tighten up. And then when you bear more weight onto the left foot, as you take a step, the left glute should tighten up. As you crack that, as you figure this out, that's when you can begin to go on more walks. Because now you have to practice this. The goal is to get to the point where we're 8 out of 10 steps, 80%, you're doing glute walking. It's okay to have a bad step here and there because you're going to the grocery store or you're shopping or something and there's a deal, or I like that thing. And you're thinking about other things while you're walking, or you're out of the park and you're saying, look at that bird. I've never seen that bird before. Or they're doing new construction at this place. You notice things when you're walking around. That's part of life. And that's good. You're having a conversation with somebody. You're not always going to be paying attention to your glutes. So it's okay. Don't be hard on yourself. The goal is to spend some dedicated time where you say, okay, I'm not going to look at the birds. I'm not going to stop and smell the roses. I'm not going to do this in the store. I'm going to do this at home where I can just focus, walk up and down the long hallway in your home or a stretch in your home and just think glute, 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 glute. Practice, practice, practice. Because you take thousands of steps. Especially if you're going to work on walking, you might take 5 to 10,000 steps. And if you can make those thousands of steps good glute steps, because you're doing glute walking, now you've turned walking into a powerful weapon against hip arthritis. And you will be unstoppable in fixing your hip arthritis so that you can avoid the hip replacement surgery. This is what is not taught in the medical field. This is what your doctor won't tell you. They just don't know this. It's not information they get taught in school. But if you guys can figure this out, you will be unstoppable. This sets you up to go into the advanced stuff that you'll find in our program. All right, let's go to the comments here and see what questions you guys have. Let me get a sip of water.
Before we get to comments, can you speak to whether or not glute walking, what phase does it belong in? Should people in phase 1 be trying to glute walk?
Yeah, great question. So I'm being asked, when should you be glute walking? What phase? Should people in phase 1 of our hip arthritis recovery program be glute walking? So here are the phases. We talk about glute walking in the second half, like near the end of phase 2. In phase 1, we tell people don't walk because you're probably in pain. In fact, you need to be minimizing the walking to the absolute minimum, like what you can just do to survive. Get help if you can. Take the motorized scooter at the store if they have it available, and get a walker. You need to be offloading. Get a walker or crutches so that you don't put your full body weight through that hip because it's going to make it worse because you're using the wrong muscles every time. As you calm things down here in phase 1, that's what we're focused on in phase 1. It sets you up to have less symptoms, which will qualify you for phase 2. Then in phase 2, we start to fire more glute muscles. That's where we do bridges and butt burners and mini squats. And then we start to do glute walk. And as you get better at glute walking in phase 2, it sets you up to do even more stuff that's advanced in phase 3 and phase 4. So those of you guys that are having, let me just review the symptoms here for phase 1. This is free. Remember, you can get all the phase 1 stuff on our website. If you have day pain, so just pain during the day in your hip, 4 to 7 days a week, morning stiffness in your hip that lasts more than 30 minutes, night pain, 4 to 7 days a week, you can't be on your feet for more than 10 minutes, and your glutes can't flex or tighten and other muscles flex instead. That qualifies you for phase one. Now you need to realize that you just need one of those things to be true to be in phase one. Most people have a few of them. They'll have 2 or 3, maybe 4, occasionally all of them. But the sneaky ones are people that say, well, I don't have any pain, I don't have any stiffness, but I can't tighten my glutes, and they said I have arthritis. You're in phase one. There's some people that can fire their glutes and they can be on their feet all the time. They don't really have any pain during the day. Stiffness isn't really a thing for them, but at night, it's bad. You can't sleep, you can't get comfortable. You tried this pillow, that pillow. You've bought different kinds of special sleeping pillows for hip arthritis. It's because of what you're doing during the day, and that muscle imbalance is bugging you. People experience pain differently. That's why we've developed these criteria this way. And just remember, one criteria is all you need to be in that phase. Oh my gosh, Kate 60, thank you so much for the super chat. She says, so thankful for your generosity, a blessed ministry. Yeah, this is my ministry for sure. You've got me pegged there. I'm glad that you're benefiting. Thank you for the donation. Our team absolutely loves that. So nice of her. Julie Parker says, instructions from doctor, take painkillers and go for a walk. Yes, that's what a lot of them say. You know, I bless their hearts. You know, I don't think that they're trying to be mean. They just don't know. They're just not trained. They just have no idea how to fix hip arthritis. They think that it's just an age-related problem that's going to get worse no matter what. And all you got to do is medicate in the meantime and move and hope that you can delay having the surgery. That's their mindset for the most part. Yeah, you can try this injection. You can try, PRP, stem cells. You can, all these gimmicky things that you can try. And some of them might give you some pain relief, but they're not fixing the root problem. They don't know about this stuff. They just say you're going to eventually need surgery. Hopefully you can delay a few years. Beth says, the orthopedic surgeon told me walking is fine. My body says follow Dr. David all the way through. Yeah, the surgeons are trained in surgery. They're physicians usually, and they have gone through a lot of school to do surgery, which is a miracle what they do. Hip replacement surgery, by the way, is an absolute miracle. Like, it is incredible that they've made parts, artificial joints that they can install in people, and it works. Like, some people have an amazing result. There's problems. You hear about them. I'm sure you guys have heard stories from friends, family, or on social media. You've been in groups, and you hear some serious issues. So they don't know the full picture of it, but it's incredible what they can do. And for the right person, the right time, it's necessary. But a lot of people can get better without surgery. Julie Parker says, I am hoping that once my glutes get a good strength level, the glutes will activate while walking automatically. Yes and no. So yes, the stronger your glutes are, the more likely you are to use them. But it's very conscious still, Julie. It's a conscious habit you have to have. I still have to work on it myself. I went running. I did 5 miles 2 days ago, and near the end of my run, I was chit-chatting with my wife as she was with me, and my hip started to hurt a little bit, and I had to stop and walk for a few minutes, and then I realized I don't think I'm using my glutes, and I'm the glute guy. I'm the Dr. Glutes. People tell me that sometimes, and I still have to work on it. So just be aware that it's not ever going to be just magic and like a switch is flipped and your glutes work magically correctly every single time. You're still going to have to be reminding yourself of it. I look at it as like brushing your teeth. You can't brush your teeth once and never expect to have a cavity. It's a daily thing that you have to maintain. Same thing with proper muscle activation. I'll just say G here. G, and do you have to lean on your weight on your leg you take a step with? And do you have to lean your weight on the leg you take a step with? Yeah, that's how walking happens. So when you take a step, you're going to lean on that leg, fire the glute on that side, because then your other leg's swinging to take the next step, and then you eventually lean your weight on that leg, fire the glute on that leg, then your first leg is swinging. That's how walking happens. It's complicated for some people. Some people get it right away. I bet someone is watching this video right now and it clicked for them in an instant. They'd never thought about glute walking and they just got it right now. And then there's some of you guys that have been watching glute walking for a while and you're still struggling with it and it's been a few weeks. That's normal. That range is normal. So that's okay. You got to figure this out though. AG says, okay, for the sitting position, when you activate your glutes, how do you really know that your thighs aren't activating as much as your glutes? I'm doing it and my glute feel burning, but no burn in the thighs. I think that's the best feedback you're going to go with. Nobody else can feel what you feel. So I would trust what you feel more than what anybody else tells you. If you feel that your glutes are working and your thighs are not working, you're probably right. Don't get in your head too much about this. I see a lot of people struggle with it. Trust it. You can put your hands on your thighs. Let me show you what I mean. You can put your hands on your thighs right here. Like, so I had you put your hands on your butt for the feedback on the muscles back here. But if you've been firing your butt muscles pretty well and that's working good, then you can put your hands on your thighs. You can look at your thighs too and just try to fire your butt muscles and make sure that they're not tightening up. Other feedback that you'll get is if you're firing your thighs is your legs will start to go up like this. Because when your quads tighten, it makes your knees straighten. So if you're thinking about tightening your glutes and your feet are floating up, you're using your quads, not good. You can also put your hands on here and look and just see if your quads are tightening up. But just remember that it's not going to ever be a perfect thing where you only fire glutes, 100% glute activation and 0% thighs. You realistically, if everything's working a little bit, I just want your glutes to work at somewhere in the range of 60 to 80%. And the thighs to work in the remaining percentage. Your thighs are still going to work, especially when you're standing. You have to activate your quads and your hamstrings, your thigh muscles, in order to stay balanced in a standing position. What I want you to do, though, is bias your glutes. Use your glutes more than your thighs. Good question, AG. Diane says, I'm a champion glute tightener until I try to do it walking. You're not alone, Diane. That is everybody. A lot of people have that trouble. They're like, yeah, I can do it. And I can even do right and left. And then walking, it just falls apart. And that's okay. The good news, Diane, is you found where you need to work. You just need to crack this now. You need to figure out how to make walking work for you. Get your hands back there. Do this at home so you don't look, so you're not worried about people looking at you if that's a worry of yours. And make sure that you're getting the control right. Review this video. I've got other videos on walking. You got this, Diane. You're gonna get it. Love that comment. New says an MRI showed that I have hip cysts in my left hip. Will these exercises help? That one's tough. I don't know. I don't know for sure. But I wouldn't worry about it. And here's why. When they talk about cysts in your hip, they're usually talking about cysts under the bone. Subchondral cysts is what they call it. Let me see if I can draw a picture for you here. Let me just erase a little bit first. Erase our motor unit. We'll trade it for a hip joint. So let's say this is your socket right here, and the bone goes that way. And then you have the ball right here, the neck, and then the thigh bone that way. I'm not very good, but what they're usually talking about when they say cysts in the hip is subchondral cysts. Subchondral means below the cartilage. So right at the joint right here, you might have what looks like a bubble, maybe on the socket side too. And what I think that is, this is my opinion, I don't think anybody in the medical field's figured this out. We're just all speculating right now. Is those are reactions to the compressive forces in your joint. So I talk about the muscle imbalance causing too much pressure in the joints. When you put a lot of pressure through somewhere on your body, the body responds by having some sort of reaction. Like I was weightlifting this morning. I don't know if you could see that right there. And I have these nasty looking calluses on my hand. I was hanging, and I have them on both hands. And people that aren't weightlifting, you won't have that, but that's how my skin reacts to pressure from hanging on a bar. The inside of your body reacts to pressure too. Muscles react to pressure. right? You do some sort of weightlifting and the muscles get tired and they feel the pressure and they say, oh, we need to get stronger. So that's how muscles thicken. Tendons and ligaments, same thing. Cartilage and bones, same thing. Our musculoskeletal system is designed to feel and adapt to pressures. When you have excessive pressure from a muscle imbalance in a joint, especially the hip joint, you get squashed cartilage, decreased joint space, or bone-on-bone situations is what they'll call that. Sclerosis is another one where you get thickening of the bone. Osteophytes is another one that you'll see on your X-ray or your MRI. Those are bone spurs. And then these subchondral cysts is another one. I think all of those are reactions to too much pressure. So the original question is, will these exercises help? And my answer to that is, I don't know if they're going to help the cysts. But what I do know is there's people that have cysts and feel better. Will the cysts go away? I don't know. But does it matter if you're feeling better? If you fix the imbalance, the pressures are normalized, you're walking better, you're doing glute walking, you're back to life as normal, I think that's a fix in my opinion. Even if you had another x-ray and it still showed the cysts are there, but they're not causing any problems, I think you're fine. Hope that helps you out. Beth says, so in phase 1, should I be doing any real walking without the offloading device, cane, crutches, or walker? I would like you to do no walking. I would like you to not put weight on your feet at all in phase 1, but that's not realistic. You have to go to the bathroom at some point or get up to have a meal or take care of responsibilities that you have. So when you do get up, use an offloading device like the cane, crutch, or walker. That's what I would recommend. Hope that helps you, Beth. Follow-up from Beth. I keep thinking about what you've said, that whether we ever have to have the surgery, we're still going to need strong glutes and lower abs to recover well. Yeah, there's some people that surgery is inevitable, truly, because it's far gone. Like these cysts and all this, it doesn't look good. The joint is beyond healing naturally. There's been too many changes in there. And when that happens, the motion becomes severely limited. This is something important for me to tell you. Like one of the safety questions that we ask for people that are applying to our hip arthritis recovery program is when you pull your knee towards your chest, on the affected side, let's say I have hip arthritis on this side, is the motion at least 80% or better compared to the unaffected side, or both sides are affected to what it was before. So if this is my unaffected side, and this is 100% of my motion, bringing my knee to my chest, that's my hip flexion motion. And on this side, I'm about 80% or better. That means that my joint is moving well. Even though it hurts a lot, even though they said I have arthritis, that ball and socket joint is mechanically good. It's irritated, doesn't feel good, hurts to walk too much, might hurt at night, but it's good. And if we can unirritate it, unsmash it, you'll probably be fine. But if the arthritis goes on for too long and all those changes happen, mechanically it might not be good, and then you might no longer be able to bring your knee up as high as you could before. And if that's consistent, because it can happen for a time, temporarily, but if it's consistently limited and you can't bring up your knee very much because your hip's bothering you, or there's a lot of ratcheting in there, locking, we can talk to you about that on the phone if you apply for a program, then that's when we say it's probably a better idea for you to go get seen in person and see if a joint replacement is right for you. And we can't help you in that situation. But truthfully, more than 9 out of 10 people that we talk to who have been diagnosed with arthritis, even bone-on-bone arthritis, can bring their knee up just fine. It hurts. For a lot of them, it hurts a lot. Some it doesn't hurt at all. But you have good motion, and that means you have an excellent shot at recovering without surgery. Got a 2-part question. Fit1964 says, I just came from the chiro appointment. They have advised that no matter what, I need hip surgery. I started using the cane to offload. I gave I have really bad groin and sciatica pain. Is it best to have an MRI to confirm the previous diagnosis of osteopenia? Well, osteopenia is bone shrinking or bone thinning. That's when your bones lose density. And if you have sciatica, there's something going on in your back, potentially in the hip. The fact that you saw somebody in person, I also weigh that a lot because they're probably seeing things that I can't see, obviously. But what you could do to know if you can heal without surgery or not is go through our program. Even if you have sciatica, we have half the people in our program have sciatica because it's the same muscle imbalance that causes back problems that set up sciatica. We talk about sciatica probably weekly in the hip arthritis recovery program amongst the members, and they get better. Our program is designed to help sciatica as well. So if you start on the free version, the phase 1 that we have on our website, see if that helps you out. Offloading, the cane might not be enough for you. You might need to offload with crutches or a walker. If you find the cane isn't enough, very often it's that you need crutches or a walker to offload a lot more. If that provides you relief, if you're starting to use your glutes better and that provides you relief, then there's an excellent chance that you might not need surgery and you might prove this medical professional wrong. And they just may not know that it's even possible because it's not their training. That's what I would do if I was you, Fit. I hope that helps you. Mr. Universal, thank you so much for the super chat. I appreciate that. And we have a question from Mr. Universal. I had several shoulder dislocations, and in a few weeks, I will have surgery. Oh, I'm so sorry to hear that. I wanted to get your opinion on my case. I have had MRI and more. How can I schedule to get someone to talk or advice to you? I'd say best thing to do is to call our office. You can call our number, the helpline here. They'll help you out. Just let them know that you're looking to set up an appointment. It's right there, 915-200-4159. And if you don't get a response, like if no one answers, just leave a message. That line is very busy, but we get back to all the messages. And then, sorry to hear about your surgery. It might be the best thing for you, might not. I don't know. If you've had a lot of dislocations, usually that means that the ligaments are loose. Like that's just your genetics, unless you're doing some sort of crazy sport that's putting you in a bad situation a lot. But if you've had a lot of if you have had a lot of injuries, then bracing might be necessary for you, like with a shoulder sling, to get the ligaments to cinch down, strengthening when it's right for you. But he says, I've had 7 shoulder dislocations. I don't know if I should get surgery. Had MRIs done. What should I do? Whew, so sorry. Yeah, I would talk to one of our therapists and see if that's best for you or not. Our rotator cuff tear recovery program could be an option for you, especially if you have a torn rotator cuff. Tear would probably hit you perfect. But yeah, I would look into that a little bit more before you have surgery. In my opinion, it's always a good idea if you're gonna have a surgery, and unless it's emergency surgery, if life's on the line, you need to have surgery as soon as you can. But if it's not a life or death situation, it's just you're in pain situation, I would get a second or even third opinion to make sure that it's the right step, because you can't undo a surgery. So I would definitely talk to somebody about that. Cindy says, Dr. David, I do not know how you do it, but you bring new information every week. I so appreciate all the help. Thank you and your team. You're welcome, Cindy. We try a little bit, a lot, to make sure that we help you guys and try to bring value, make sure that you guys are making progress, answer your questions. So thank you, Cindy. I appreciate that. Kimberly says, thanks for always being here for us. We appreciate you so much. You're welcome, Kimberly. I'm happy to do this for you guys. I feel like this is my life mission, is to help you guys heal from arthritis, make sure you don't have surgery if possible. Kate says, don't be a hearer only, be a doer of the instructions. Yes, you cheer them on, Kate. Good job. Thank you for that, Kate. With that, we will start wrapping up. You guys go do this stuff. Like Kate, take Kate's advice here. Don't just be a hearer, a listener, be a doer. If it's right for you to do this stuff, start applying it. You'll be surprised. What have you got to lose? At worst, you'll be the same. At best, you'll make progress and possibly even say, I don't need to have surgery anymore. I'm feeling better. Guys, thank you so much for joining me this week. We'll see you next week. Bye-bye.